All right. Hi, everybody. This is Jeff with Heritage Investors, and I'm really excited today to talk to a good friend of mine, Heather Majka. Heather's been in the healthcare and insurance business for a little over 20 years. And for the last 2.5 years, she's owned her own company, Citizens Insurance Solutions. And she's been a Medicare subject matter expert as well as a Social Security strategist. So I'm really excited to have Heather on today. We're going to get into today just some of the Medicare stuff. So, Heather, welcome. It's good to see you. How are you?
I'm doing great. Thank you for having me.
All right. So into Medicare a little bit. I get this question a lot. I do a lot of personal planning, especially for our small business owners, and whether they're looking to get out of their business before age 65 or we're approaching age 65 and still in the business. We get into the Medicare questions. So first of all, just in a couple sentences, what is Medicare?
Medicare is a health insurance for people who are 65 and older, or they are disabled. They've been deemed disabled by Social Security. And it's, government federally funded through paying FICA taxes all your life and working.
Okay. So I know as we approach 65, now this is whether you're a small business owner or not, as we get within about 6 to 8 months, maybe even 12 months of our 65th birthday, the mailbox, the email inbox, everything else starts to fill up with ads and flyers and you name it on Medicare. A lot of people just don't know what to do with all this solicitation. Who is really going to help me versus who's going to sell me something I really don't need? How do we get through that?
That's a great question. By working with an expert like myself and my team here at Citizens Insurance Solutions, we can help you cut through all that noise. We can explain things in a couple sentences that piles and piles of mail will try to tell you, and they will be selling you because, let's face it, we love what we do, but we do get compensated if we sell someone insurance. And anytime they're sending you solicitations in the mail, they're going to try to just push their agenda and that one solution on. And I'm going to tell you one thing right now. Insurance companies, like if you call 1-800 insurance company, they have, a $10, $15 an hour person who reads a script, basically meeting certain goals where they are trying to push a certain type of plan on people, regardless of what that person needs, because that's just what they need to do. So I definitely think working with us, we can tell you, hey, look, you're just looking for something from the state and or the federal government, and everything else, advertising, if you want to read it, great. But if not, toss it away. And the very thing that's very important to know is the documents and information you actually need are so discreet, they don't even barely get on your radar compared to all this other stuff that looks like it's from Medicare or it's advertising for Medicare insurance. That's very important to note.
I love that 1-800 insurance company. And we do run into that a lot. So I guess then you and your team are going to sit down and sort of help individualize or customize a solution then, as opposed to sort of that 1-800 insurance company kind of comment.
No, you're exactly right. We will find out, like some people will call us all the time. Hey, I'm turning 65 in February. What do I need to do? We will determine, because that answer really is very individualized for each person, depending on where they're at with their career, where they're at with their financial goals, their health goals, what other insurance is available and that type of thing. So we sit down with somebody and specifically guide them through what their timeline looks like for them, because it is going to be different for everyone. Now, sure, everyone can sign up for Medicare 3 months prior to 65th birthday. Everybody can do that, but not everybody needs to do that, number one. And we will help, again, understand if they need to do that or when they need to do that and how they need to do that. We actually hold their hand during the process. We have videos, we have all sorts of great tools and a team of people that actually dedicated to helping people transition from whatever their current health insurance is to Medicare at the time that's right for them.
And I know that some of our business owners and even our pre-retirees are looking at Medicare as a target date because they know they might not be able to afford or certainly don't want to afford the cost of healthcare prior to picking up Medicare. We think of those Medicare premiums as being pretty affordable typically, but can they go up? Can those Medicare premiums be higher, especially if we're selling a business this year or making a lot of money this year?
Actually, I'm glad you asked that question. That is such an important question. And so business owners particularly need to be very, very, very aware of this. The Medicare premium that everybody kicks around that seems low is a base premium only. It is absolutely not what everyone pays. What everyone pays changes every year, and it's based on 2 years ago, your adjusted gross income from 2 years prior. So in 2022, your premium is based on your adjusted gross income from your IRS taxes from 2020. And for 2021, which is the year obviously we're in, they're looking at your adjusted gross income from 2019. So any married couple over 176,000 or an individual over 88,000 is going to pay up to 4 times that amount of what the base premium is, depending on, there's like a big staggered, not big, but there's like 5 different levels that you could possibly have to pay.
Sure. So we've got that stacked premium, and
Mhm.
we don't want to get lured into that. My Medicare is going to be $130 or $160. We have to be a little more careful with that, don't we?
That's right.
Okay.
And also keep in mind that even if your Medicare premium would be the base premium, say for 2021, it's 148.50. It doesn't mean, even though you might not like your insurance because it's $600 a month, or the deductible went from, 1,000 to 8,000, or all the different things that people are experiencing right now and have been for the past few years, it's not always cheaper to take Medicare, and I wouldn't necessarily advise someone to do that in every situation, especially if they're gonna continue to work. But again, that's why we help tailor that response and know, so you can know, or that person that we're working with knows exactly when they should do whatever they need to do. And some people actually, like I said, don't need to sign up for Medicare if we advise you not to. So we like to tailor that individually, but if I have to give generic answers, I certainly can.
And is so often the case, especially with our business owners and folks getting ready to retire, it depends. So there is no one answer fits all, and it's really hard to fall in or easy to fall into that trap, and hard to avoid it. So you do want to have a trusted advisor, someone that like, and trust, that you can talk to about your circumstances and make sure that we get a customized solution. Yep.
Exactly.
Yep, yep. So I know there are a lot of different events when I can sign up, and we already talked about that might not be necessarily when I should sign up. But what are some of those events? We've talked about age 65, but if we
Yep.
don't do it at 65, when can we sign up for Medicare? And I know it's different for Part A and Part B, right? There are different parts and pieces and plans
Yeah.
and
So typically people are going to get A and B together, typically. And they would do that when they're 65, or if they've become disabled, Social Security, they're going to be drawing Social Security because Social Security deemed them disabled. So they're already getting Social Security. So anybody who's turning 65 and already drawing Social Security, or is deemed disabled from Social Security, is automatically going to get a Medicare card. Now, again, we work with the person to evaluate, should they keep Medicare and or other insurance, or should they not keep Medicare and keep the other insurance. We work with them. So there's the time that you're turning 65, the time that you're starting to draw Social Security and or are disabled, or 65. Okay. So you got your 65th birthday when you start drawing Social Security. Obviously, when you're going to retire, or if you're going to get out of a business, let's say a lot of people are hanging on to working because of the health insurance aspect. But
sure.
if they know that there are other solutions out there that are affordable and that meet their needs, why they sometimes want to go ahead and retire and enjoy life. So we can help somebody transition to a different health insurance, even if they're not Medicare eligible. We represent all plans and options in over 25 states.
Okay. And then if we do hang on to our current health care beyond age 65, whether it's through another employer or through our own, as the employer, we sponsor a plan. Uh, Maybe at 68, 69, 70, I'm looking at getting out of the business or pulling the trigger on retirement. Can I still sign up then?
Yes, and so that's interesting. You asked about the different parts. Sometimes what happens is ideally people who are using Medicare are definitely going to have A and B, right? A is your hospitalization and B is like everything else, like your outpatient services, your x-rays, your durable medical equipment, all that kind of stuff. Surgeries, outpatient surgeries, ambulance rides. Um, you can actually sign up for Medicare anytime that you are working, and you can indicate what date you want it to start. So somebody has the right to actually sign up for Medicare up to 8 months after they've stopped working. But I would never encourage somebody to even know that number, because that would cause a lapse in coverage, or it would force you to get Cobra. And Cobra currently, as the law is written and has been for many, since Medicare started in 65, Cobra is not sufficient to Medicare, and they would penalize you if you took Cobra and delayed Medicare. So again, what I give advice to people is I say, look, contact me 3 months before you're going to retire, 3 months before you're going to start Social Security, 3 months before your 65th birthday. If you do one of those three things, or when you get notice that you've become disabled and you get a favorable disability award, any of those four things, let us know so we can help guide you through the process.
Because it
Because
can be a real
it
confusing,
can.
hot mess is what it can be.
It
Uh,
really can. And there are people that are working that have A and not B because they got Social Security early and they rejected B because they were still working and they didn't need it.
right. So let's move on to the next one then. I hear, and this is a lot of the stuff that fills up my mailbox, right? This is that Medigap or supplements and Advantage plans or Part C. Now, we talked about A and B, so let's talk a little bit about Part C versus Medigap or supplements. What can you tell me about the difference there? And is there a one size fits all? I kind of know the answer to that one. And and how do we get through that?
That is the most important thing that anyone becoming eligible for Medicare needs to understand. And that is the pinnacle, aside from caring about people's health, um, safety, and well being, and being kind. That is the number one thing that I want our agency to be known for, is to really make sure that each individual on Medicare clearly understands the difference between the two, because they are as diametrically opposed as they could be. They are complete opposite. And we want people to make the choice that they want to make and know why they're making that choice. So Medicare supplement, this is how I tell everybody. A Medicare supplement is the Cadillac, and a Medicare Advantage is the Camry. And supposing they're both new, they're both great cars. They both get you where you want to go. It's just they're two different cars, right?
Right.
So a Medicare supplement, I call it a Cadillac because the benefit of a Medicare supplement is you can go to any doctor or hospital in the country without any restriction. Like anybody who takes Medicare will see you. And you don't have to have an insurance company stamp of approval on whether or not you can actually get treatment paid for. Because if Medicare pays, the supplement has to pay secondarily. There's no like ifs, ands, or buts about it. So that's why Medicare supplement is much different than Medicare Advantage, which is Part C, and it's an optional part of Medicare. It combines A, B, and D together, which it's a great option, don't get me wrong, but it's not for everyone, because I want to make sure that they understand that here's the limitations. If it's not an emergency, you have to go to doctors that take your plan. And sometimes that's just limited to your geographical area, and sometimes it isn't. In East Tennessee, we're very blessed that we have nationwide networks, but it doesn't mean you can go anywhere. You still have to go to the doctor that takes that plan and that network, unless it's an emergency. No matter what insurance you buy, when you have an emergency on Medicare, you can go to any hospital or doctor in the country. Now, the other restriction on Medicare Advantage that I want people to really understand. And again, it's not saying it's a bad thing. I just want them to understand what the limitation is. And that is that if you need a surgery, if you need, something expensive, if you need a lot of physical therapy, if you need injections, you name it, if they're going to be if the insurance company is going to be paying for something other than some basic preventative things, they want to put their stamp of approval on it. And it's important to understand the difference between Medicare Supplement and Medicare Advantage as soon as you're faced with the decision, because what could happen is if you love your Medicare Advantage plan because that's what 1-800 insurance company told you to buy, and they didn't even tell you the difference, nor will they, because everybody makes more money. Everybody makes more money if you buy Medicare Advantage. And I'm not saying Medicare Advantage is bad. I'm just saying that's a reality. Okay. So when you call 1-800 insurance company and you pick a Medicare Advantage and you didn't understand that that was a limitation, and 10 years down the road, you get, let's say, I don't know, something wrong with your heart and you need to go to, Cleveland Clinic, and they don't take your Medicare Advantage plan, and somebody says, why don't you just get a Medicare Supplement, go back to original Medicare? You can't, because you can go back to original Medicare, but you're not going to get a supplement because you're not healthy enough and you're in the middle of a health event on top of it.
Is that where
So
that
that's why it's
pre-existing
so important.
condition comes in?
It's actually not really pre-existing condition so much. I mean, it's what everybody thinks of pre-existing condition, but pre-existing condition in the health insurance world means that they're going to not pay for something for a certain amount of time. But with Medicare supplements, they're medically underwritten. And if you can't pass the health questions, they're not even going to eliminate pre-existing conditions because they're not insuring you.
Gotcha.
So that's why it's critical to really understand the difference when you're first facing the decision, because you may later regret it if you didn't understand the limitation of Medicare Advantage.
All right. So that gets us through A, B, and C. Now, what about this magic part D? I can remember this one because D and drug, I can put those together. So tell me a little bit about how the prescription drug plan, or Part D, works, and this penalty that I keep hearing about.
I'm definitely going to answer that. I will just say one thing about Medicare supplements. So it's very confusing because all of the supplements are letters A through N. So you have a Medicare supplement plan D. Can you imagine? You have a Medicare supplement plan A. So that's so confusing. The alphabet soup of Medicare is quite confusing, and we're here to help with that. So back to Part D, which does make sense. It's a part, and the D stands for drugs. It actually is a fairly new program. It only rolled out in 2006, and it was never intended to pay for everything, but it's completely changed the landscape of us as Americans, our longevity, and everything in the medical industry. It's completely changed everything. Drug prices, everything. So all drug plans have similarities because, of course, they have to follow Medicare's guidelines, but they're vastly different as well. So this is what I tell people. We need to, again, look at everyone's individual situation. And what we do for people is we will take their drugs and the pharmacy that they like to use, and we'll find a plan, because we represent every single plan, that makes their cost the lowest and covers their drugs, right, that they want to cover. Because every year these plans change, and we tell them from month to month what they can estimate their cost to be, because their cost can change from month to month because of the coverage gap or the donut hole. And that looks different for everyone, because anytime you change the insurance company, the drug, and or the pharmacy, or any combination therein, your prices month by month change. So that's why we do an individual report for people, so they can plan kind of how, you're living on a fixed income. You want to know, if I'm paying $200 for medicines in January, what happens in July? Am I going to all of a sudden owe $800? And that's a real situation that happens with people.
Yep, it
So
sure is.
the penalty, just so you know, is only put on to people if they didn't select a Part D plan when they were first eligible for Medicare or have coverage as good as Medicare's. So, for example, a veteran who is eligible for VA healthcare, they're not required to get Part D because their veteran VA healthcare is considered credible. Not in all veteran situations, but in those that are using the VA and enrolled with them. So they wouldn't be exposed to a penalty. But those who are, for example, suppose you became 65, you just didn't sign up for Part D because you're not taking drugs. Why do you need it? People think that all the time. Well,
Sure.
Medicare wants you to participate because the average cost of a drug plan is about $38 nationwide. And you and I both know $38 doesn't cover everything that we need covered. So they need people healthy and sick to participate. So they penalize you if you do not participate or have coverage adequate, and that penalty sticks with you for the rest of your life. So again, we help people guide them through that process and avoid any kind of penalties.
All right. Well, thank you very much for that insight. Ultimately, I guess it comes down to, how do I know what's best for me and my family?
That's a great question.
Whether I'm retiring or selling my business at 55, whether I'm looking at retiring at 70 from a great corp company with a great plan, or whether I'm just shooting for that magic 65 number. How do I know what's best for me?
Well, hopefully business owners learn this because they're so busy, they have to learn this. But just because you can change your own oil doesn't mean you should change your oil. And so you really want to work with someone who has a lot of wisdom and depth and breadth of knowledge to tailor a solution for you. Because if you go it alone, it definitely can be done. You can totally go on the internet and look it up and try to figure out what you need to do and have all these people that you don't want calling you, which, by the way, I forgot to say, no one should be calling you about Medicare unless you specifically permitted them. So if somebody's calling you about Medicare, I absolutely would not deal with them because they're breaking rules. So that's that.
That is good to
Only
know.
you should be initiating the phone call to someone that you trust. But if you do go it alone, there can be some major problems, and you want to try not to do that. You want to lean on someone who just is all about the wisdom and the knowledge. Again, there's a lot of information everywhere, but we're about wisdom and caring.
I'm a DIY guy, and I have been playing in this world for a long time, and I wouldn't do my own Medicare. So there are parts and plans, there are supplements, there are penalties, there are higher premiums. There is all kinds of stuff. There are several things to wade through here. So I think the bottom line is, we need to find someone that we know, trust, who's been doing this for a long time and can help us find the customized solution that we need. Someone like Heather and her team over at Citizens Insurance Solutions. Now, let me ask you this. If you could leave our listeners with one little tip or nugget of wisdom about anything out there, what would it be?
Oh, anything not even Medicare related?
Eh,
Okay.
whatever you
I,
got.
I'll
What do you got, Heather?
I my company and I are taking our part and our responsibility for doing these three things. And I just ask that everybody live by these three things if you can. This is my words of wisdom. Be kind. You never know what people are going through physically, emotionally, what they've been through, all sorts of, just be kind. Just, it's simple, it's easy. You would want someone to be kind to you, so be kind,
That's
be
fair.
safe, and be healthy. Those are our three very critical things that we personally embody here at Citizens Insurance Solutions. And we do our part to make sure that we do that to one another and to the people that we help. In fact, we always, every time I train everybody, I always tell them, you make sure that you treat everybody who calls us just like they're your beloved family member, whether it's your mom, your grandmother, whoever it is.
And that's exactly how we think too here at Heritage. So if whoever I'm talking to, would I make the same recommendation to my parents or to my sister? And if I can say yes to that, then I can sleep well at night. As a matter of fact, as a fiduciary, we're required to do that. So Heather, again, thank you so much for your time. I'm looking forward to talking to you again. I think the next time we talk, we're going to get into the hot mess that is Social Security. So
Yes.
we'll be looking forward to seeing you again. In the meantime, have a great afternoon, and we'll talk again soon.